Hi, nursing suicidal patients. Back home in Nigeria, I didn't have a lot of experience nursing suicidal patients. Maybe because the incidence is less and the resources also are far less. Another thing I can think of is many of those patients were nursed in the psychiatric ward, so they are kind of like limited there. But over here in the United States, and I believe other developed countries, you can come across these patients in multiple settings. You can see them in the ICU, you can see them on the floor. Maybe if they have a treatment plan that is running alongside with suicidal attempt or ideation or wherever they may be. So they may come to the hospital for reasons other than the suicide, their suicidal attempt or ideation. So because of this, you can find them, you can come across them in ICU, you can see them on the floors, you can see them in med-surg as well as in the psych units. So there are many settings where you can see them. So it will be a good thing to familiarize yourself with how to care for them. So I'm going to give some tips on how to go about that. So first, there is a suicide screening tool. It's part of your assessment. When the patient comes in, you screen the patient for suicide. So what that does is that it tells you the risk level of that patient. The risk level will now be what will guide you if it is low risk, if it's no risk, moderate risk. So it is that risk level that will guide the plan of care. That's what it will say, what should be done to the patient. So that screening tool, you are going to not only use it at the beginning of your treatment with the patient, you are going to continue to screen the patient throughout their stay in your unit or in the hospital, as the case may be. So that screening tool will ask specific questions about if the patient want to harm themselves, if they have a plan of harming themselves, if they have access to whatever they want to use. So it's kind of clear. It's like you go through a checklist, you ask those questions, and then you put the answers in there. That is what the screening tool does. It is assessment. Then another thing to consider is safety, and safety is safety for the staff and safety for the patient. So since the patient has a potential for self-harm, you should watch out to prevent that. And then also you should watch out that you are also safe when you are taking care of the patient. So to keep the patient safe, you should remove anything that will pose a danger to the patient, that anything that the patient can use to harm himself or herself and others. You should remove any cords in the patient's room. There should be no pen in the patient's room. The trays that come into the patient's room should be disposable tray, not anything made of metal. Then there should be no belts, no shoelaces, nothing sharp. And then there is a special gown that they use for them. You know, the regular gowns, you can tie, it has ropes you can tie at the back of the patient. But this one has no rope because some patient can snap that rope and use it to harm themselves. So the special gowns they use have maybe something like Velcro to put it together. Velcro or sometimes buttons, to clip it together. So just make sure that it is not something the patient will use to harm themselves, and definitely not those gowns with ropes. Then the patient should have a one-on-one sitter. There should be a person inside there 24/7 with the patient. So they call those people sitters. So they stay in there and watch the patient and make sure that the patient does not do anything to harm themselves. Never leave the patient alone. Then in your assessment, make sure you ask direct questions. Some of the questions are, are uncomfortable and they sound somehow, but you just have to learn how to get used to the questions. You have to ask them directly. Do they want to kill themselves? Do they have a plan of doing that? What is their plan? Do they have access to a weapon? You know, all those kind of things. The screening tool will guide you on all what to ask the patient and what to do. And then the patient should not be in a private room. Rather, the patient should be in a room that is close to the nurse's station and that is not private, so that everything that the patient is doing will be under observation. Then you should also undertake room searches. Go into the room, search the room from time to time, because those patients can be very clever. They've been thinking about this thing for a long time and they have so many devices to go about it. So you should check the room. And when you are rounding on the patient, you go to check the patient. Don't round at a particular time, maybe every hour. At 12 o'clock you go, at 1 o'clock you go, at 2 o'clock you go. When you do that, they plan accordingly. So what you should do is make your rounds irregular. Just enter there maybe 10 minutes past 1. Then after 2 minutes you go inside. They just make it an irregular rounding. Then when they have visitors, make sure you search all what the visitors come with, because some of the visitors may not know what they may bring that the patient can use to harm themselves. So some facilities even do not allow visitors in, or do not allow visitors to bring anything. So if your facility allows, there will be facility policies, so make sure to follow that. Then use therapeutic communication. There is something called therapeutic communication. You communicate in a positive way. Don't do anything that will trigger the patient, and be non-judgmental. Don't do anything that will make your bias about the patient to come across and be perceived by the patient. That is not professional. Then there should be referrals and resources that you should connect to the patient. Thankfully, there is a lot of it around here. There are organizations, there are places, hotlines that you can call and get help. So all those should be made available to the patient. And then documentation, very important. Make sure that everything you do for the patient is documented. So there are platforms in the electronic health records where you are to document your rounds, document that the place's environment is safe, and all that you need to do to make sure that everything is documented. Thanks for listening. Make sure to like, share, and follow for more.